What is it doing?
Welcome back to the Movement is Medicine podcast. Dr. Gene Shirakabrad here with Dr. Megan Weezer, Dr. Cory, slightly less bicep how.
You know, it's very fitting that I would injure my bicep.
Because they're so big?
Why is
Yeah.
that so fitting?
Because, I don't know, I'm always doing bicep curls, and, I don't know, it's just a joke that when we do, like, a bro workout, we program those, and then I hurt my bicep.
It does fit the brand.
Yeah.
Yep.
I think at this point I would have put money on one of your butt cheeks based on how much you've been clapping them.
I don't think I had an idea as to what you would injure, but I definitely thought it would have been you trying to do some stupid party trick out there.
Yes, that's what I'm glad for. Well, let's talk.
Should probably tell them what happened.
Yeah. Sure. I tore my bicep tendon in my left arm. I don't know if you can see from all the way back there, but there's some bruising.
Oh yeah, it's like yellowish.
Yeah, that
Yeah.
bruising showed up later.
Mm-hmm.
So part of it, we didn't know the extent of the injury because there was no bruising and there really wasn't a ton of pain. But long story short, I tore my bicep tendon.
I mean, we're still
Tell them how, like the
still-
mechanism.
Yeah, we're still getting started with the podcast, so you don't have to make the story short.
Oh, okay.
Let's make
Okay.
the long story long.
Gene and I were moving a fridge, and it started to fall off the dolly, and
because the door opened. Yeah.
Mhm.
Yeah,
It's
that's
one of
what
those
we think
big
happened.
commercial
Yeah,
fridges from Territory Foods.
imagine like
We're gonna sue.
No.
Territory Foods are coming for you.
No.
Imagine like a gas station fridge, like big like that, glass
But the door
front.
opens, it doesn't slide.
Right.
Yeah.
That's a good point. Yeah, the door opens. So that's what we think happened. We were moving the dolly. It started to fall. I think it was because the door started to open. It's big, so I couldn't really see it fall or see the door open, but that's what I think happened. And without thinking, I just reached out to grab it.
Mhm.
And as soon as I did that, I felt a pop in my left bicep. It was instant. It was like pop, and then I let go, and the fridge fell. Megan and Carrie
I
were
heard a crash.
back
We were
here.
sitting right here and we were chatting. It was a fairly serious conversation too. And we both hear the crash and we look at each other and Carrie goes, "Nobody better be hurt."
It was me.
So I followed Carrie out there. We're walking and we're like, "Is everyone okay?" And Cory, being Cory, goes, "Everything's fine."
So at that point, I was
He
in.
said, "I don't believe you."
I said that too because I thought
Yeah.
everything was fine. And
Yeah,
then he
I mean,
goes,
we were both standing.
Wait,
None
wait,
of us
wait.
were crushed underneath the fridge. But at that point, I was in like analysis mode. Like I was. It's almost like when
doing an
you're.
audit.
Yeah, your computer like freezes and does an assessment. That's what I felt like. I was just standing there like this. And I was like, I think I'm okay. Or I think everything's okay. And then I was going through everything. And I was like, I can't move my arm. And I was like, I think I tore my bicep. It was literally some of the first words out of my mouth.
Literally, you sat down and you looked pale and you had your arm just like limply sitting in your lap and you said, "I think I tore my bicep."
Yeah.
And I had one of these in my hand. I put it down. I said, "Okay, hold on."
Yeah.
And
So
then
grab my
started
hand.
looking at you.
this is a pro tip. If you're going to tear a bicep tendon, do it at a place worked and operated by physical therapists because I had 3 triage people all around me, like poking and prodding and moving things around and like assessing. And does this hurt? How does this go? I blacked out.
You
I don't
did.
know.
you
You
were-
did.
you were
I
out.
said supinate. You said, "I don't remember what that is." Right
Oh,
now."
yeah.
Yeah.
I do remember that. I do remember that.
Remind me what that is.
I said, "Turn your hand like this. Turn
Yeah.
your hand like this."
Yeah. Yeah. Supination and pronation is
You were like, "I don't know what that is right now."
Use different words, please.
So
Draw a
Like,
picture.
okay.
it was weird. Like there was a little bit of pain, but it was mostly
You
like
also almost passed out. Do you remember
You
that?
got very
yes,
pale.
I do. So it was mostly like shock.
Yeah,
Like
you definitely want shock.
after analysis mode, and I thought that I figured that I tore my bicep. I sat down, and then after a while, I remember saying, I think I'm. Or, I
Getting
don't know if I
lightheaded.
got dizzy or
Lightheaded.
yeah,
You were
lightheaded,
nauseous, you said.
nauseous. Okay, yeah. So they like.
I said, "All right, let's lay you down." You said, "But it feels better sitting up like this." I said, "Well, you're gonna pass out."
Yeah,
so.
you're gonna be down either way.
Like, we gotta
Yeah.
get your blood pressure up.
Yeah.
Like-
So they got me laying down, and then I felt better after that. But I think it was
Yeah.
just like initial like it set in like I might have done something bad.
Yeah.
I don't want to. I don't know. I was just thinking about everything, so I got a little nauseous. But
we had like a sympathetic response
yeah.
to
Yeah.
It was a traumatic injury.
Yeah.
Like,
Yeah.
that's what it was.
Sure.
Yeah, I think that speaks to, like, it doesn't matter how much knowledge you have. There's still physiological things that happen. Like,
Yeah.
it doesn't matter, right? Like,
Yeah, you can't fight
you
that.
can't fight that,
Mhm.
and your body was going through a natural response. Like, because you said you felt no pain. That's one of
Yeah.
the reasons.
Right.
Your body's so amazing at adapting to preventing you from happening, that it would rather have you pass out or just kind of zone out, disconnect, than feel what's going on, which is it's kind of crazy.
It's just interesting with stuff like that because I had the same exact, like, so the first time that I fractured this one, I had a sympathetic response. Like, I felt nauseous and I, like, could see stars and I felt like I couldn't move my hand. And then when I did this one, the one that I needed surgery on, I did not have a sympathetic response, but I had no pain. But I also, like, I felt like I couldn't move my hand. I felt like I had to support it. Like,
Yeah.
those were the one commonality between the two.
Yeah, it was so stupid because, like, I remember, because for me it was like it happened in slow motion the other way, because I thought it was like, because I was behind the fridge holding it behind it with the dolly, and it was starting to fall, and I was like, and you're like, oh, it's falling. I'm like, let it go, because I'm like, in my head it's trash anyway. We're trying to throw it away.
Yeah.
Like, let it go, and it's falling, and it falls, and makes a big noise, and they're running out. I'm like, oh, it's funny because it made a big noise, but it's trash. It doesn't
It was
matter.
like the loudest crash I've ever heard here. I was like,
Yeah, I'm like, I mean, who
something
cares?
bad just happened.
I mean,
Right.
we're throwing it away, so
You probably thought worst case scenario the glass broke.
that was my
Yeah.
that was my worst case scenario. I looked
Yeah.
at the glass and it didn't break, and I looked at my feet and they weren't crushed.
Yeah.
And I looked at your legs and they weren't crushed. Like, you were standing in one
You're
piece.
like, oh, we're all good.
Yeah.
Yep.
Because you had a smile on your face initially, because I think you probably had the same response. Oh, my
Yeah.
legs aren't crushed.
Right.
I'm good. And I was like, okay. And they're running. I'm like, oh, it was a big noise. It's fine. Like, don't worry about it. And then I see your face starting to get white, and he goes, wait a minute.
Yeah.
I thought the door swung open and hit you, and I thought it was traumatic because it, like, hit, not because
You thought maybe it was going to start
No,
bleeding
you
or
just
something?
grabbed the
I was
thing.
literally waiting for his arm to, like, open up and blood start gushing. I thought that's what was going to happen, which didn't, thankfully.
Yep.
I mean, it's still not ideal the way it happened, but I don't know if it would have been better if it was, like, opened up and gushing everywhere.
I told Eugene that people, I've been telling the story to people, and they're like, oh, I'm sorry that this happened. I'm like, it could be worse. I could still be stuck under the fridge. This happened a week ago, by the way. So if I'm still under the fridge,
Literally a week ago today.
Today, yeah.
yeah, a week ago.
Right
today.
now.
Yeah, like 1:30, so almost a week
Yeah.
on.
And then Carrie took you to the emergency room, which
Yeah, we didn't know what to do.
well, we did, but
We knew you needed an MRI, not an X-ray.
That was the thing. Yeah. Because I didn't have pain, I didn't expect there to be an avulsion fracture, which can be common when a tendon ruptures. Sometimes it can pull from the bone like that. I didn't want an X-ray. I wasn't having much pain.
I think that's just the first order of business
yeah.
nowadays anyway.
Yeah.
And Gene has a physician friend that he was able to get me into the next day, but in the meantime, we were like, should we do something now or not? Because I just didn't want to prolong anything.
Yeah.
So we went to the ER. It was kind of a waste of time. They basically were like, if you're not dying, you can go home.
Yeah, your arm's attached. You're
Yeah.
good.
Yeah. Follow
I mean,
up with.
it's fair.
Yeah.
It's their triage job, yeah.
But it was still good to go. I've just to be safe, when something like that happens, it's fine.
Yeah.
But yeah, so thankful to Gene and Dr. Sedgley. Shout out to MedStar Orthopedics. They were able to get me in the next day and kind of check things out and order the MRI that the ER wouldn't do, and confirmed yesterday that it's a full thickness bicep tendon tear. Distal bicep tendon tear. Yes, that's correct. Distal bicep tendon tear with 2.5 centimeters of retraction. So that's about an inch. It definitely could be worse. That bicep tendon could be retracted like all the way up. So there are some fibers still kind of holding it down a little bit. But they typically recommend surgery at that point. So that's where we're at right now. I have tentative scheduled surgery for potentially on Friday.
Did you say tentative?
Tentative.
Okay.
If I didn't say the N.
I thought he forgot the N.
He tentated the surgery scheduled.
You know those commercials where they throw the red flag
Yeah.
and do a
review?
challenge? Yeah,
Yeah.
we could do that.
Go
We
ahead.
literally
Um,
can because we have cameras
Yeah,
everywhere.
right. That's what I'm saying. Yeah. So surgery could be as soon as this Friday if everything falls into place. If not, they do surgery every Friday, so I'd have to wait till next Friday. But so it's kind of a funny running joke in our household that Carrie's birthday
Hmm.
like is never. I don't know. There's always something going on her birthday. So in undergrad, her birthday's April 28th, which happens to be this Friday.
It's coming up.
That my surgery could be scheduled on.
Mm.
In undergrad we always had finals last week of April, and then in physical therapy school we had more finals. We took our board exam like the day after her birthday or something like that. Like it's just since we've been together we've almost never been able to have like a normal birthday for her.
Chill.
And then we move out here and COVID happened.
Mm-hmm.
So we had a quarantine birthday.
Yep.
And it's just been like one thing after another. And this year she's turning 30. And we're like, let's have a good birthday. We're gonna schedule a cruise. We're gonna, this gonna be a good birthday. And then I tear my bicep.
You
and-
should have known because it's a big birthday. So
Yeah.
something big was going
Right.
to
Yeah,
happen.
something big will happen. So I feel bad with that, but we're happy that if we're able to get in on Friday, then it's good regardless. I'm not saying this because she's upset by any means. It's just more like me. Like I feel bad that I'm taking up her birthday, but she's fine with it.
Well, it's a
She's
birthday she'll never
spouse.
forget.
That is true.
Yeah,
Um,
as your 30th should be.
after you went to the ER, like I got the fridge up, and Megan's like, "What are you doing?" And I'm like, "What do you mean? What am I doing? I'm getting the fridge out throw it away." She's like, we can't have anybody else going. I'm like, this is bro code. The fridge did this. The fridge needs to go.
I think I said I'm scared.
Yeah.
Good.
Yeah. I mean, the ironic part is after that happened, like, like everything that went wrong. So tape the door, put the air into the
Into the tires on the dolly.
Yeah.
the dolly. Yeah.
Also, that's Jahantab's dolly. Thanks for leaving that
Yeah.
here for literally the
Well,
last
Yeah, it's
year.
Johansson's fault.
I told him he'd be hearing from my lawyer.
After territory. After we talked to territory. But yeah, it was it wasn't that bad to getting it out after we had like
I mean,
everything.
yeah, it didn't fit through that one door, so we
Yeah.
had to come around.
I should have known. I've had that happen
I don't
before
know
with
if I would
like
have thought to secure the door though on that.
No, I mean it's always after the fact.
Like I always
Yeah.
like when I move dressers and stuff.
Yes,
I'll
that's what
I'll
I'm
take
saying.
the drawers out or I'll tape them. Like depending on how big of a dresser it is, you know
Yeah,
what I mean.
right.
But
after one like crushes your fingers, you're like, damn it, no. Now I know.
but those like easily move in and out. Like
Yeah.
it's a fridge. There's like a suction level to it.
Yeah, I guess maybe that's what we were thinking. Like if there's magnets holding the
Yeah.
Yeah.
door closed, but
See?
regardless, it
Faulty
didn't work.
fridge, Territory Foods. Lawsuit.
I don't know. We're gonna get in trouble for saying all this. We're gonna hear from Territory's lawyer for a cease and desist of.
I mean, it is their fridge. The surgery we talked about. I think the interesting part, and you and I chatted a little about this. You had surgery, obviously, for your wrist. But it is a weird feeling, kind of going into surgery, knowing that it's going to happen, and then the process after it. Right?
I know what I was gonna tell you
What?
earlier when I started to say something and forgot. What's weird for me is knowing that I'm gonna wake up likely in more pain than I go into. Like a lot of
Yeah.
times
Mm.
people go into surgery maybe because they're having a ton of pain and their hope is that they wake up feeling better.
Yeah.
No, they still wake up in more pain at first.
Yeah,
though, because
that's
of
why I
the
said
surgery.
hope. That's why I said hope.
Yeah.
They hope that they'll feel better,
Surgical
or
pain
or
is
feel
different.
different. Yeah, maybe they have different pain.
Yeah.
But it's kind of weird to think like I'm gonna fall asleep with my arm feels normal or not normal, feels okay when I'm not moving it. So I'm gonna fall asleep with feeling all right, and then I'm gonna wake up and it's gonna be locked into place and probably have a bunch of surgical pain. So that part's kind of weird to think about. But I think it'll be what we've been reading and what we know about the recovery process is the surgery's pretty straightforward. Recovery should be pretty straightforward, although it's kind of a longer process because the tendon has to be that retraction that we were talking about. They're going to pull it back down into the attachment point on the radius, one of the forearm muscles, and then sew it into the bone.
Hmm.
And what they told me is that I'll feel better very quickly, pain wise.
Really?
But I still won't be allowed to do much because they need, like, that area needs that long of a time to fully heal and be able to accept external load again.
The nice thing is that it's not a huge like tendon repair, that it's a tendon reattachment with, but I'm sure
Yes,
there's
right.
some repair,
Yep.
right? Because tendons don't heal really well, but bone does heal really well, right? Like when you had your fracture, the downside was you had to have a plate put in to put it together. Like if it was just like
Yeah.
a fracture and a cast, it's not as drastic. But even with yours, when it's resutured or re-anchored into the bone, it's the bone healing that hurts a lot because bone is so
It's
sensitive.
very vascular. Yeah.
The tendon itself won't hurt. That's why you can
And
usually get moving pretty quickly.
And that's why I didn't bruise that much.
Yeah.
Because tendons themselves aren't as vascularized as like the muscle belly. If I would have torn a muscle in the muscle belly,
Yeah.
there would have been a ton of
Yeah.
bruising. You can Google like pec tears.
Yeah, and it would have hurt a ton.
Yeah,
'Cause
yeah,
it's
a lot
so
more
much
pain.
nerve there.
Yep.
Yeah, so you got that for you. The pod, like you always, I think that's a normal human nature response, right? Like you can go in one of two directions. Like you can spiral and go all the worst cases and the what ifs, and go in the other direction and look at, well, it could have been worse, and here's how it's going to benefit. Like you know, the acceptance piece
Well,
of
I
it.
think our profession kind of gives us like we have both like the burden of knowledge, but also like that knowledge gives us so much perspective, like because of the patients we've seen and stuff.
For sure.
I don't know.
Yeah,
You
definitely.
just kind of have a more realistic, like I guess, breadth of possible case scenarios that could happen.
Yeah.
So
I always, my thought experiment is always, what is the worst case scenario, right? Like most people do, and if that is the worst case scenario, you're still doing okay, because then you can just plan around it.
They do that in the. They did that in the show This Is Us. Randall and his wife would always, if there was an issue with the kids or something, they have to like discuss a important topic. They're like, all right, what's worst case scenario of how this will go down?
Yeah.
And then they, it's always better than that. So
Yeah.
it
Yeah.
Like
ends
that.
up being okay.
Yeah, the tweak that I do with the worst case scenario is I always ask, is this the worst case like imagined scenario, or is this a worst case realistic scenario?
yeah, right.
So like I always try to bring it back to realistic, right? If this is the worst case realistic scenario, great, then you just plan around it and accept it as is, instead of drudging on it or having it weigh you down. And then it's just about living life and dealing with those situations, which I think works out okay.
I think every injury makes you a better PT, though.
I can probably agree with that. It gives you more perspective to draw upon and to have empathy for your patients of what they might be going through. If anything, it just like makes
You can
you
relate to them a little bit more. But also like I don't know, like this probably wouldn't be the case until like well after like you've recovered and you're out of like an immobilizer and stuff. But like I think about my shoulders and I just experiment with different movements and stuff based on like where my pain is and what the pain, like how it behaves and stuff.
Yep.
And that just kind of adds to my like repertoire of like what I'll try on patients. So
Yeah, in a very non-clinical aspect,
practical sense,
it's
yeah.
the same reason why I like to go to the classes in the morning that I'm coaching that night, because I've experienced it and I can give the members like tips of, you may feel this during halfway through the workout, whatever. Just give them extra perspective. So it's kind of the same with injuries.
Yeah, it's a different level of awareness that your body gets. Like you're forced into such an introspection with your body to process it and go through it, but it doesn't make it any easier, right? Like your recovery had ups and downs, but it was a pretty linear up. But like there's still like, I tell in
The
rehab
slope,
that
yeah.
you go from here to here, but to get there you're still going through ebbs and valleys.
I draw that oftentimes on almost every eval that I do, because especially
Wait,
for
you drawing people?
yeah, that'd be funny. Especially for people with like chronic pain or whatever, it it helps them to visualize that.
Not every day's
Progress
going to be
is not
good, but
linear.
overall, the picture.
Yeah. And that's the same with fitness too. I've drawn it for pathways, where people are like,
Yeah.
I need to get to here. Like, great, you might get there, but there might be some ups and downs in there as well.
What's the typical recovery time frame for a bicep tear like yours?
They told me both doctors that I saw told me about 6 months. The
6
first,
months for normal or for 6 months for like you?
I think what the 6 months means is like normal person.
Okay.
I'm anticipating a little bit longer to get back to like our level of exercise.
Because I had the same exact thing. I don't remember the time frame, but like it was around. I'll have to go back and look at my videos and stuff, but I want to say it was around the 6 month mark where like everyday stuff I was fine, but like I still couldn't clean and jerk or do pull ups.
Yeah, I think daily function probably at maybe even the 4 to 6 month mark. I'll feel mostly normal. At that point I should have full range of motion in flexion, extension, and supination, I believe, and pronation. But the strength will probably be the last piece to come back.
Well, I think you're also gonna have a layer of fear too.
Yeah.
To overcome with that.
Yeah.
Right.
Typical return to sport.
Yeah.
But good news is I work here, so you guys can keep me in line, and we'll likely have a lot of physical therapy sessions together.
We have all the time.
My goal is to do as many bicep curls as I can on my right arm and see how big of a difference I can get from hypertrophy of my right arm to atrophy of my left.
You do know there's like an 11% crossover effect, though.
Nice. See, that's why I'm going to do it. So the left arm will get strong even without doing bicep curls.
So you should still be doing bicep curls, is what I'm saying.
Yeah, all the bicep curls.
My MRI said patient has strongest biceps I've ever seen.
It was weird that it was written in Sharpie over top the actual report.
Over top of the impression.
Yeah.
A lesser man's arm would have fallen off, is what it said.
Weird. That was in Sharpie as well. Interesting how they do reports nowadays.
Oh, God.
I think you'll be largely like everyday function in 4 to 6 weeks.
4 to 6 weeks.
Because I think the most
I don't think so.
the most painful part or the most initial challenge in healing is the bone reattachment.
Yeah, but aren't there range of motion restrictions for the first like 8 weeks?
There may
6
be.
to 8 weeks, something like that. But active range of motion, passive range of motion, they'll be a little limited, but it's not the healing, like feeling normal, and that'll be like for lifting things. Range of motion, it's because like bone healing, if you fracture a bone, you're in around 6 week time frame.
Yeah.
That's what hurts a lot initially and heals up. And a lot of the range of motion limitations, because again, the tendon isn't necessarily repaired, it's reattached, right? Then the tendon is still intact, so you don't have to wait for tendon healing. You just have to wait for the attachment site to heal up. And then, like you said, the tensile force, that usually starts building up in 4 to 6 months, just to make sure that the callus in the bone where the attachment site is stable, and then you can put more and more load onto it. So yeah, 6 to 8 weeks or 6 to 8 months, and then we usually say with like reattachments like that, 12 months you're like not thinking about anything, like you're just living life. But that 6 to 8 month mark is like the fun rehab, right? Where you're just loading and doing bicep curls.
Nice.
Chin ups again.
Yep. Any other thoughts? How did you approach surgery? Because was that your first surgery, the wrist one?
Yeah.
How did you go into it? Like, what was your mindset? Do you remember?
Hungry and thirsty.
That's how you went into it?
Well, they told me I had to fast for like 24 hours.
You know, they haven't told me anything yet, but they sent me over a packet that I haven't looked through, so that probably says it in there. What's the worst thing that'll happen if I don't fast?
You'll aspirate and die.
Oh, all right.
That's yeah.
Okay.
It'll mix weirdly with the anesthesia that you're
Like,
giving.
worst realistic case scenario is you will die.
Okay. All right.
I think
I'll listen
you
to him
can
then.
get a little bit more creative in the worst case scenario. Give me a second. I think the worst case scenario is whatever you ate mixes poorly with the medicine, which wakes you up in the middle of surgery.
Yeah, you feel everything, and then you aspirate and die.
Yes. And
Okay.
then you throw up because of the pain from
Yeah.
the surgery. And then they revive you and you're still feeling the pain, and then you aspirate and die.
Okay.
Yeah.
Yep.
So
Okay.
throw some pain in there.
I'll probably
No, yeah.
fast.
Well,
then.
I mean, it's, maybe I'll do it.
I mean, okay.
I remember being so angry that I had to fast for that long. And then I went and looked up like the American Academy of Anesthesiology or whatever, and their latest recommendations were like so significantly less than 24 hours. And I was like, these fuckers are so behind on the evidence. Why can't I have a bagel or a drink of water? It was so mad.
I literally remember that because you were raging to me.
Honestly, I don't know if I've ever gone 24 hours without eating.
I don't know if it was 24 hours. I think it might have been 12.
I've definitely gone 12 because there's
Yeah.
times where I don't eat until the afternoon,
Yeah.
just if I'm busy or whatever,
Oh,
which isn't
was
the
it
best.
24?
But
It was. I remember it was a lot.
It's
was
up
enough.
there. Yeah.
that's
was
why
high.
that's why it's always optimal for people to have surgery in the morning because then you fast overnight. and
Yeah,
you don't-
mine
you don't-
was at like 1 p.m.
Yeah, right. So I don't know. I don't know when that'll be. I should have looked it up probably by now, but it'll be okay.
What did you ask me? How did I go into
Going
surgery?
into surgery. Like what? How was your mindset? Like what were you thinking? How'd you feel after?
Were you nervous? Were you?
I don't think I was nervous or anything. I think I was like, Erica dropped me off, and I think in my mind I was like, all right, I'm gonna have the surgery. She'll drop me off back at home. Cool.
Yeah.
I don't know why I thought that because I was literally having a plate and bones a plate and screws put into my bone,
Yeah.
which is like highly innervated, highly vascular.
All the
Like
pain
I
stuff.
was gonna fucking feel everything.
All the pain stuff.
And so Erica took me home and held me hostages at her apartment for like 3 days. Thank God, because the pain literally brought me to tears.
Mhm.
That first like 48 hours after were miserable.
Yep.
And I was like, I think they gave me Oxy and I took one. And I remember thinking like, okay, this makes me feel like I'm going to throw up and it's not really touching the pain. Why am I bothering?
Yeah.
So then I just alternated between ibuprofen and acetaminophen every, I don't know, however many hours you
Yeah,
count,
10
3 or
minutes.
4 or something like that.
Yep.
But going into surgery, I don't think I was all that nervous or anything. Like I was just like, I need to get this done.
Mhm.
Like I don't think I don't know. I didn't get nervous. I was just like, okay, we'll just do this thing and see what happens.
Yeah.
I was horrible coming out of anesthesia though. Like they were like, is this your first surgery? And I was like, yeah. And they're like, okay, next time you get surgery, tell them you get nauseous and you don't do well. Because they'll give me,
Ugh.
they'll change up like the cocktail.
Yeah.
And they ended up giving me some kind of patch to put on behind my ear, which is something they normally would do beforehand if they know that you get nauseous
Like
with
Dramamine?
anesthesia.
That's a good idea. Did I ever tell you guys when I had my wisdom teeth out what happened?
No.
So it's
Were
the
you
only
like David after dentist?
No. I had my mom record me though, just in case I said something funny. It wasn't that funny, but no, that was the only other time I've had surgery, and I almost don't count that, but it is. I mean, they put you under,
Yeah.
and they
Yeah.
so I had anesthesia, and my mom took me home, and she went to go fill the prescription. She was going to leave me for like 15 minutes. The grocery store was, right across the street.
Where's this going?
So I woke up, she put me on the couch, and I'm sleeping or whatever, and I woke up, and I thought I was going to throw up from the anesthesia. So I'm still loopy at this point. So I go into the bathroom, and I start to feel like I'm going to throw up, and then I realize there's gauze in my mouth from the surgery. So I take the gauze out and put it on the counter, and then I was like, I'm tired again. I'm going to go to sleep. So I laid down on the bathroom floor and fell back asleep. So my mom comes home. I'm not where she left me. She looks in the bathroom, sees blood on the counter from the gauze and me on the ground. She thinks that I went in there, fell, hit my head, and I'm like,
Oh my God.
it was funny. In
I'm
hindsight.
sure that was her thought. It was funny.
Yeah.
Yeah, exactly. Unbelievable.
Wow.
Carrie's gonna have an exciting birthday, I think.
Yes. I think it'll
I
be
don't know. I don't think you'll be loopy because they don't let
No.
you go home until you're like good.
out of it.
True. Side note: it must run in the family because my dad got his wisdom teeth out, and same thing. My stepmom took him to the pharmacy to fill the stuff, left him in the car. He got out of the car and started walking down the road. So,
It's like hitchhiking.
I cannot wait to see your dad's comment below in this podcast episode after he listens to this to hear the full story of that.
Yep.
Oh, God,
wow.
that's funny.
That's something.
I remember when I was coming out of anesthesia, it was awful. Like it took an extra like 2 or 3 hours, I think. And somebody was like, "You're a lightweight girl, aren't you?" And I was like, "What the fuck does that have to do with anything?" Yes, I am.
Yes, I don't participate in building up my anesthesia tolerance. Thank you. I don't go anesthesia drinking at the bar. No.
Yeah,
I'm
I
good.
mean, I don't know. I don't remember feeling any type of way going into the surgery. Like I was like, "All right, let's do this."
Yeah.
And
You had a really inspirational recovery too, in a sense that you didn't let it stop you from working out
no,
as best you
I
could.
worked out. Well, I still have so many videos of
Yeah.
me in a sling just doing one-armed workouts.
Yep. A lot of
Mark got a lot of practice putting my hair up.
Shut up, Mark. A lot of unilateral front squats for
Yep.
you. A lot
Kettlebell
of
swings.
kettlebell swings. Bike. You rode the bike a lot.
Thrusters. I rode the bike a lot.
Yep.
I did
Mhm.
dumbbell hip thrusts, pistol squats,
Mhm.
lunges.
Yeah, it was cool to see that we, or you in this case, I haven't done it yet, can walk the walk too. When we say like you can still come in if you're injured or things are hurting and we can modify things. It's one thing to say it, but it's another to do it.
Yeah, I honestly don't think my fitness level declined a whole lot, really.
Mm-hmm.
Because by the time I was able to start doing more bilateral things, I still had to ramp that up anyway.
Yeah.
So, like, my cardiovascular system was still able to keep up with what I was doing
Mhm.
muscularly
Yeah.
because of what I had done.
No,
I
you're
think I probably still worked out like 3 times a week.
Yeah. I think you also kind of had to for sanity's sake. you
Oh,
know,
yeah. I
just to
remember
keep
the
moving.
day after I found out I was having surgery, I came to the 3:30 class and just hopped on the bike with my fucking sling and was like pissed off.
I have either pictures or videos of you with every injury in some kind of sling recovery workout mode.
Oh yeah, Megan still has me beat by injuries, 3-1, I believe. So both wrists for Megan and her ankle.
Mhm.
I was driving Cory to the doctor's appointment the day after, and literally one of the first things he talked about was him being concerned that Megan was going to talk shit because he got hurt too.
Wait, what?
Yeah, because we always make fun of you that that you always get hurt. So now you can be like, remember when you got hurt? So
Also, speaking about getting hurt, just to touch on our lovely members that have so much love, I walk out into like
Oh,
to
this
get
is so
something.
funny.
oh no,
the next day or something, I walk
So
out. This
it
class
was
going on.
it was a few days later. I want to say it was Thursday because I didn't know how much we were telling people, and by the time
Mhm.
Thursday had rolled around, at least a portion of the members had seen you in the sling, so they knew what happened.
right
Okay.
because you coached Wednesday.
So
Yep.
I was explaining to the 8:30 class or whatever class it was. I don't know.
Yeah.
It must have been 8:30 because you were here.
Yeah.
To the 8:30 class what had happened, and it was a full class. I was going over like my perception of what had happened and explained what went on and where we were and whatnot. And Dan was like, "Okay, can we get on with it?" Like he was like. He was like, he doesn't care about, what did he say? He was like, he doesn't care if you get injured, like, let's move on. And I was like, yes, he does.
is
This
Dan,
whole
Dan
time-
C or Dan H?
Dan Carpenter.
Okay.
This whole time he thought it was Gene who got injured.
Yeah. Yeah, 'cause he looked at me like I walk
Gene
out.
walks out.
Yeah.
He goes, I heard you got injured. I was like, no, it was Cory. And he was like, oh, well, now I feel bad.
Yeah, he looks at me. He's like, "You look fine." I'm like, "What do you mean?" He's like,
Thanks. No.
Yeah, it's like, yeah, I've been working out. He's like, didn't you like hurt your arm? Where's this thing? I'm like,
I was like, that was Cory.
that was Cory. And like, you could see his face like drop.
He was like,
he was like, I was talking shit. I feel so bad. And I'm like, thanks, jackass.
Yeah.
And
yeah.
everyone's like, oh, it's Cory, not you. I'm like, what is happening
No,
here?
it wasn't. Everybody
Thank
knew
you,
it was
guys.
Cory. I think it was like 2 other people, but it was funny. Dan was like, God, now I gotta buy him a coffee or something now.
Yeah. Like, oh, if I knew it was Cory, I wouldn't have talked so much smack. I'm like, thanks, guys.
You guys
He's like,
love
I
me.
thought you were talking about Gene. I was about to be like, he doesn't care. He
Yeah,
has
we
no
don't have to worry about
empathy.
it.
That's
He's
what he
fine,
said.
yeah.
He's like, Gene has no empathy.
Yeah, we move on. So yeah, that
That's
unbelievable.
funny.
Yeah, it
Unbelievable.
was funny. And then automatically, he was like, oh.
Yeah, and then it was everyone's worried about Cory.
Mm-hmm.
As far as our members go, like as long as things go according to plan, I might have a week off of
Will.
I
will have a
That's
week
debatable.
off.
No.
1 to 2 weeks, probably.
Yeah,
at
least 1 week.
At least
Sure.
one.
Where like literally will be recovering from the surgery, but after that I plan to be able to come back in here, and it'll be no different than me coaching in a sling
Yeah.
beforehand, just with one hand. It'll be a lot of hey, can you demonstrate this for me, or
And then see what they're doing wrong.
yeah, or do this but with both hands. That's
Yeah,
my
yeah.
go-to right now.
I think the recovery will be different for you with this type of injury than hers.
Yeah, I
'cause she was
agree.
in a lot of pain all the time.
Yeah.
You will be the opposite. I think for you, it's
Your
gonna
pain
be
will dissipate pretty soon.
yeah,
I
and
think.
it's gonna be hard, like not to do more,
Right.
like to
Right.
maintain patience as you go through it.
And I think a younger me would have had more trouble with that.
Mm-hmm.
But in my old age, I've started to, I don't know. You just learn more things as you go, and I'm okay with playing it safe and doing the right things for a while.
Well, I think you have a different outlook on like fitness and your relationship
Mm-hmm.
to that as well. Like,
And just physical therapy related recovery stuff, and I can appreciate
yeah,
some of that too.
Well, that I just mean like, I don't know. There was a time, and even probably a little bit during, which is probably what motivated me to keep doing workouts 3 times a week. Like, I thought I was going to lose so much progress.
Sure. Yeah.
But there's a line of like having that line of thinking and not having it be self-depreciating, and having it be like, no, this is good for my body right now.
Yeah.
Knowing this one, he'll like 8 months deadlift 375 and be like, oh, I lost progress. I'm not deadlifting 425. I lifted 375.
475.
Correction.
Gonna snatch 225 before.
Yeah, I'll get through it.
I hope I use this time to do what you did though, Megan, and like do stuff that I don't want to do with both hands. So
Vegetables?
Eat vegetables. Yeah, I should probably eat more vegetables in my recovery.
Definitely should. Micronutrients.
Like I don't do a lot of biking or unilateral work in general. This is going to be a great time to do all that stuff. And
I'm pretty sure I still have an entire note in my iPhone of all, like one-armed workouts, like stuff I did. I should send them to you.
yeah, and I'll do half of it because I don't want to do all that.
And on that note, I think it's a good closing thought. So there you go, a little update on Cory. If you've had surgery, be cool to hear your stories. You could leave comments below about how your progress has went, your headspace going into it, and afterwards. So you could leave a comment below if you're watching on YouTube. If you're listening on iTunes, just go watch on YouTube. Stop listening. Just go watch.
No, listen. That's
both.
the only way I listen to these. Audio.
Play the audio on Spotify, and then play the video, but mute the video so the audio comes in.
So we get
double
both
views.
benefits.
Yeah.
Nice. Good strategy.
Yep.
All right. Thanks for tuning in to the Movement is Medicine podcast. Go subscribe on YouTube or wherever else you listen to podcasts like Megan, if you're into just the auditory experience of
Listen,
such things.
I have like a 30 to 40 minute drive twice a day, every day. So
How did you like the what's it called? ASMR or something?
ASMR.
Is that what it is?
Yeah.
How did you like that episode?
With the
Did you
coffee
listen
drinking.
Did you listen to that one?
I don't think he put that audio on.
No, I didn't. It was just a podcast.
He hasn't posted
okay.
anything on Spotify since like literally February.
Yeah, we're like 4. this is gonna be the 5th episode that we're audio only behind, just because
okay.
I'm forcing people to watch.
Or you're just lazy.
I am many things, Megan. Only sometimes lazy.
Yeah. Okay. He knew something was gonna get thrown at him if he didn't say that.
I have to walk that one. When you have so many things going on, you got to be lazy sometimes. So you
You
don't
gotta
explode.
also prioritize.
That's right. And right now, audio is not prioritized. All right. Thanks for tuning in. We'll catch you again on the next episode of Movement is Medicine podcast. And we'll probably see the post-surgical, Cory.
Cool.
And see how you're doing.
Yeah.
I think we did rehab progress for you for a little while.
What do you mean?
Like we were tracking how you're progressing.
That was during the time that I had fracture recovery.
Yeah.
Look at this. I have a bunch of. Look at
Good
it.
times.
I have an entire freaking note. I'll
She
share
does
it
it.
with
She
you.
found it. All right.
I even have dates and everything. I'm so organized.
So organized. Thank God. Thank God for that. All right.
I can't
We'll see you
tell if
again.
you're being sarcastic.